And I'm here with one of our hearing instrument specialists, Quinn. And today we're just here to talk to you a little bit about hearing loss and brain health and kind of how they're connected and the importance of understanding that connection in protecting your hearing. So for our clinic, we have 4 locations. We're located in Hamilton, Paris, 2 in Paris, and 1 in Brantford. And once again, like Robin said, if anyone has any questions at the end, we're happy to answer those. So for today, we're going to have a few topics that we're going to go over. So we'll start with how we hear, and then we'll move on to the side effects of hearing loss, and then hearing loss in the brain, and how we at Sound Choice Hearing are able to help you. So first, how we hear. There's a short video here that kind of explains it with some graphics.
Oh, I think the sound isn't working on the video.
You might have to share your sound when you share your screen. I think that might be the problem.
Well, there's subtitles. It should be okay.
Is it
Yeah, we'll have to listen to it without sound. So, when we classify hearing loss, there are 3 different types: conductive, sensory neural, and mixed hearing loss. The most common of the 3 is sensory neural. So first I'll start off with conductive. So there's a factor that affects the sound passing through your middle ear space. That could mean a blockage of earwax, foreign objects lodged in the canal, and even a ruptured eardrum. Sensory neural hearing loss is when the actual nerve sending sounds to your brain is becoming damaged. It is most commonly associated with noise exposure over time, medications, sudden loud bursts of sound, auditory tumors, and most importantly, our overall health and well-being. Finally, mixed hearing loss is when there's a combination of the 2 previously mentioned types occurring at the same time. Sensory neural hearing loss is a progressive degenerative disease, meaning that once a loss has started, it will continue to decline. That's why it's important to understand that hearing is not repairable, it's treatable. So next we'll move on to the side effects of hearing loss. Anyone with untreated hearing loss oftentimes will avoid situations where they have the most trouble hearing, like in a noisy environment, at a restaurant, or family gathering. If they are unable to hear in those situations, it can cause them to feel embarrassed because they are saying pardon frequently. This can lead to anger and irritability. These situations are often very stressful with untreated hearing loss. If you have untreated hearing loss, you may find that you are straining to hear what other people are saying, which can cause fatigue. Studies reveal that hearing loss has a marked impact on people's social and emotional well-being. Because listening is so demanding, frustrating, and challenging, people with hearing loss often experience fatigue, stress, irritability, and even anger. All of these emotions can cause an individual to avoid certain situations, perhaps ones they absolutely once loved, which can lead to depression, social withdrawal, and feelings of loneliness. All of the side effects of untreated hearing loss boil down to one major side effect: social isolation. With untreated hearing loss, an everyday conversation can be a struggle and frustrating for the person with the loss. This can result in loneliness and further isolation. But we know how well you do or don't hear can be the tip of the iceberg in our world of health concerns. We often have other health concerns that we find more important than our hearing. It may mean that doing something about your hearing is low on your list of priorities. Treating hearing loss is in many ways a domino effect.
And we're going to switch over to myself, and we're going to talk about hearing loss and brain health. So, with cognitive load for hearing loss, when there is a hearing loss that is left untreated, individuals tend to find themselves where you have a mental effort to understand speech and conversation, where your brain is working overtime. So it can become very, very tiring. And especially within noisy environments, your brain can typically picture and pick out different types of sound. So in like a restaurant, in the grocery store where there's a lot of noise going on, noisy environments, your brain can typically take out that background noise automatically. With anybody who has hearing loss, it isn't like that. So that's why with hearing aids, they have noise reduction and things like that in the hearing aids to kind of help take out that background noise. Okay. Let's see. Oh, sorry. Can't you see your Okay, sorry. My screen didn't come up like I wanted it to. Coming up like that. Okay. I think it's this one here. So ear to brain paths can always be looked at like a highway or a residential area where there are lots of exits, entrances, and different pathways to several different places. With each path, there's a different section where the sound goes. So depending on the sound, like the pitch or the bass, depending on the volume and where the sound is coming from, like directionality. It each goes to a different part of the brain when it's processed through the ears. With a decrease in hearing, the hair cells in your ear are not being stimulated as much as they should be, which is causing a decrease in the stimulation of the brain, which is directly related to sound processing. If you have a hearing loss and you hear the word salt and the person actually said fault, that you're going to have a very different conversation than kind of how your brain processes it. So this part can actually lead to a lot of embarrassment. Like if you say, hear the wrong word and they said something else, it can cause a lot of embarrassment, and it can also cause a lot of isolation. Okay. So individuals with hearing loss, within the brain structure, there is a slower processing speed just because of the loss itself, which can reduce a lot of the connectivity between the different parts of the brain. And one thing to keep in mind that our brains are very adaptive. So if, you're not hearing and you're having hearing loss, and then you stimulate with a hearing aid, your brain is able to adapt again to take out that noisy environment like it used to, and things like that.
So I'm just going to talk a little bit about a study that came out. So this is the Lancet Commission. They released a study in 2017, and it's a US study about dementia prevention, intervention, and care. So the study was then later refined in 2020. And in this, they found that people with hearing loss had almost twice the risk of developing dementia over the next 9 to 17 years. Later, the study found that there is a 30% higher risk of dementia for each 10 decibels of worsening hearing loss. And then there was a third study that showed that even small amounts of hearing loss below the 25 decibel threshold was linked to poorer cognitive abilities. So all of this is to suggest that hearing loss, even minor loss, can affect cognitive function.
So there are some risk factors for hearing loss. There is the cognitive decline. So seniors with hearing loss have a higher risk of developing dementia than those who retain their hearing, and it increases over time. So each year, generally, hearing loss does get worse, which can cause for an even more significant cognitive decline. Smokers have a 70% higher risk of having hearing loss than non-smokers. With hearing loss, there are a lot of balance issues that come with it. So people who even have a mild loss are 3 times more likely to have a history of falling. Hearing loss is twice as common in people with diabetes than people without. High blood pressure can also be an accelerating factor of hearing loss in adults.
So just to link it all together with dementia research. So Alzheimer's disease was discovered in 1906 by Dr. Eloise Alzheimer's. And then for the next 100 years, the focus was on finding a treatment. Unfortunately, there is still no true cure or treatment. But in 2005, the focus shifted to include prevention. So then in 2017 and 2020 is when that Lancet Commission report came out. And then in 2022, the Alzheimer's Society of Canada released the landmark study. And this study redefined dementia in Canada. It gave us Canadian data on who was affected by dementia and then the modifiable and non-modifiable risk factors. So the study has been released in 2 parts. The first is navigating the path forward for dementia in Canada. And then part 2 is the many faces of dementia in Canada, which was released in 2024. And then part 3 is set to be released sometime this year. So then just a little bit on the risk factors. So this landmark study found modifiable and non-modifiable risk factors. So the 3 non-modifiable are age, gender, and genetics. And then there are the modifiable. So these are things that we can change. The study broke them up into life stage that they are the most impactful, that they are addressed. However, just because it's grouped into that certain stage doesn't mean that it can't be addressed at other parts of your life. So in early life, the risk factor is lack of education. In midlife, it's hearing loss, traumatic brain injury, hypertension, alcohol misuse, and obesity. And then in later life, it's smoking, depression, social isolation, physical inactivity, air pollution, and diabetes. So hearing loss accounts for 8% of these modifiable risk factors. And you may also notice that there is some overlap between these risk factors and the risk factors for hearing loss that were just mentioned. So specifically smoking, diabetes, and hypertension. And then also falls as well because of the link between TBIs, brain injuries, and then the result of falls, which could be physical inactivity and social isolation. So hearing loss and cognition. So hearing loss, specifically untreated hearing loss, can have a large impact on cognition. So it can reduce cognitive stimulation, can increase social isolation, cause a loss of independence, create difficulties with everyday activities, and cause strain during information processing. So untreated hearing loss can cause a barrier to engagement in these activities, and it creates a barrier to working your brain and being independent. So just some tips on maintaining brain health. So the first is to treat hearing loss. So this could be with hearing aids, listening devices, amplified telephones, anything that can allow you to still engage in everyday activities. And I believe we're going to go into talking about a couple of those in a little bit. Stay socially engaged. So this can reduce stress and social isolation and it also increases mood and cognitive engagement. Keep your brain active, so pursue lifelong learning. Break or change up your routine. So even little changes can work your brain in different ways. So try to just change up your morning routine, do it in a different order, or take a different route to the store. Engage your brain in challenging games. So things like crosswords, Sudoku, or even card games with your friends or family. All of this helps to build your cognitive reserve. And then also prioritize sleep. So sleep is so important for cleaning and recharging your brain. So aim to have at least 7 to 8 hours of sleep every night. And some tips on supportive communication. So first is gain attention before speaking. So make sure that the person knows that you want to say something to them. So maybe say their name before you start talking, or lightly touch them on the arm. If you're trying to talk to a person living with dementia, make sure to also approach them from the front so you're not startling them. Speak face to face. So make sure you are facing them directly so they can see your lips and your facial expressions. Speak slowly and clearly and don't shout. So we generally have a tendency, if someone's not understanding us, we just talk louder. And that doesn't always help. Try to speak slowly and clearly instead. Use visual cues, so nonverbal communication, so gestures, facial expressions, and make sure you make eye contact with the person you're talking to. And then if necessary, try rephrasing what you're saying. So give someone enough time to answer. And if you see that they're still struggling, try to say it in a different way. Try to say it more clearly and maybe use some more simpler words. And then there are some environmental considerations. So try to control the noise. This could be just turning off the TV or the radio, or it could be going to a quieter room if your room that you're in is too loud. Lighting, make sure that there is good lighting so that nonverbal communication can be seen and that lips can be easily read. And then lastly, sit strategically. So try to have the person with their back to the crowd so that they can focus on you better. This goes for someone with hearing loss or someone with dementia. So if you're going to a restaurant, you could always try to request a booth in the corner if that's possible so that you're kind of away from distraction and away from a little bit of that noise. Or you can also just try going at a time where it's not as busy. So just a little bit about how we can help. So first, from the Alzheimer's Society. So we have support and counseling. It's for people living with dementia, for care partners, for family or friends. And then we also have various different support groups available as well. We do education. So education for people living with dementia, for care partners, family, friends. We go out into the community and do different education with community groups. And then we also do education for healthcare professionals and first responders. For health and wellness, we have various different programs. So we have our exercise programs like Sit to Be Fit or Minds in Motion. We have art programs, and then we have social programs like our social cafe. And then for information and referrals, so we offer a lot of resources. The Alzheimer's Society Canada has a national resource library where you can access any resources on there. And then we can also help you with system navigation and accessing community supports. And then we also have BSO, so Behavioral Supports Ontario, working with the Alzheimer's Society as well.
And how we are able to help is we offer complimentary hearing tests. So you're able to see if you do have a hearing loss, completely free just to check it out. We do offer wax removal services as well. Free hearing aid trials. So you're able to try a set of hearing aids for a week for free just to see how you like them and see the benefit that they truly have. Let's see here. We do tinnitus assessment and management. So that is ringing or buzzing in the ears that is constantly there. We will assess that, make sure that everything is going okay in your inside of your ears, and then we can assess accordingly. And we also do central auditory processing tests just to see how the auditory nerve is doing in your ear and make sure that everything is okay there. We also offer assistive listening devices and FM systems if need be. So depending on the hearing test, we can assess with you just to see if you need any special kind of added accessories for your hearing loss and things like that to make your life a little bit easier. And we also offer custom noise plugs. So if you find that, loud noises really bother you, we can use special material to custom make a noise plug to help with noisy situations, like at concerts, if you drive a motorcycle and things like that. What a typical appointment would consist of is we would bring you into the office, sit down and discuss your history with hearing. If you've noticed that, you do have hearing loss, or if you haven't really noticed it, but somebody else has, we can kind of discuss that. We will take a look in your ears, make sure your eardrums look good, as well to see if you have any wax in there, which we can remove. We will complete a complete hearing test and fax a copy to your family doctor just so that everybody is aware of what kind of hearing you have and your doctor is aware. And we will also recommend, depending on the hearing loss, the perfect kind of type of hearing aid for you if you need one. And you can have that trial for those demos at no charge and no obligation. And then here are the different types of hearing aids. As you can see, this one here is the most popular. I find that this one is the most popular just due to it sounds the most natural. So you put this on, you will notice that there is a little bit of a different sound, right? Because it's mechanical, but it is definitely more natural with these types of hearing aids here. These ones here are also recommended for a certain type of hearing loss. So one of these could definitely work for you. All of these ones are custom made for your ear, whereas this one is not, but it can be made that way with a custom mold on the end here. Some of the misconceptions about hearing loss is that your hearing stays the same each year. Generally, it does not. It tends to get worse every single year. With hearing aids or without hearing aids, it tends to be a lot worse each year. Another misconception is hearing aids will damage my hearing. That is not true. What happens when you put the hearing aids on, you're stimulating your ears, which is stimulating the brain, which is allowing things to be easier to hear. So when you take the hearing aids out, it's going to seem like, oh, my hearing has gotten worse. It hasn't. Your brain and your ears have actually gotten used to being able to wear the hearing aids and to be able to hear without any kind of restraints, no stressing to hear other people. See. Misconception: hearing aids exercise multiple areas of the brain. This is true. It does. It stimulates the hair cells in your ears, which stimulates multiple parts of the brain so that you're, like we talked about before with the noise reduction. So that is one part of the brain that it's stimulated, whereas the speech is another aspect as well. So it does exercise multiple parts of the brain. Okay, I think that is everything.